Hi, my name is Rachel Rodriguez Cruz, and today is December 11, 2022. This is Unit 4 Case Studies Presentations. For these, I chose Case 3, which is we are given a case where a 47-year-old male is presented overnight with his pain his right great toe, and after um, lab exams that indicated elevated plasma urate and normal urinary uric acid, um, and also after him indicating that he drinks regular soda for like 4 to 5 liters per day, which is huge amount of consumption of fructose. He was diagnosed with gout. So first, I would like to point out that our body uses several pathways in which it breaks down fructose into purine, which is like, so we get fructose 6-phosphate, and then we make uh, ribose 5-phosphase, which eventually we then synthesize into PRPP, which is our starting point to make purines. So due to that, fructose gets synthesized into purines, which is further broken down into uric acid. So therefore, if someone were to increase by a significant amount, like our patient, their consumption of fructose, then their body would increase the synthesis of purine, and this would of course increase the synthesis of uric acid, which could increase the excretion via the urinary tract, or it could also be accumulated in greater amount in our patient's joints, which leads to the condition of gout, which is what he was diagnosed with. I'm sorry, I'm sick, so I might cough a couple times. So since in the lab test it shows that the uric acid level of the patient is the urinary uric acid level of the patient is normal, this means that our patient is not excreting uric acid as much as he's consuming fructose, and that is also shown due to his high level of plasma uric acid. So due to all of this, I would say that the impact of this dietary modification that our patient made has impacted his health significantly by provoking a significant increase of uric acid in his plasma, and enough for it to accumulate in his joints, like his right great toe, and cause him to have gout. So in this case, our patients are drinking regular soda, which is it has a lot of amount of fructose on it, making him develop the gout. So keeping that in mind, when we're given the three options, whether overproduction of purines, decreased establish of purines, and decrease in urinary excretion of uric acid levels, to see which one was the primary cause for our patient's gout, I would say that the primary cause is the overproduction of purines, because our patient, in our patient, this is what is happening. I'm sorry. So since he increased by a significant amount the consumption of fructose in his daily diet by drinking 5 liters of soda, then this would explain this would explain the overproduction of purines in his body. And a decreased salvage of purines, I don't believe he has, because this would cause our patient to have this would not cause our patient to have gout, since a decrease in salvage purines would indicate a decrease of the synthesis of purines, and this would not cause the overproduction of uric acid in our patient's body. So it's not a cause for his gout particularly. And the other option was a decrease in urine excretion of uric acid, and the excretion of uric acid, through the urine, is within normal rates. So even though it could be a factor, even though it could be a factor for our patient to have gout, like it wouldn't be the primary cause of our patient having gout, since the increment of purine synthesis is what causes an increase in uric acid synthesis. And this doesn't have to do with a excretion of the uric acid. Like, our patient keeps excreting uric acid at the same levels than a normal patient, but his body has produced too much due to increment of fructose in his diet. So I believe that this is not the primary cause of his gout. I'm sorry. The second case that I chose. The second case that I chose was a 50-year-old woman, which presented to the emergency department with fatigue, weakness over the past 6 months. She has had diarrhea. She also had numbness and tingling sensations in her lower extremities and loss of balance. Most of all, her vitals were normal, except for a little bit of tachycardia. She also presented with a hard murmur. After examination and everything, she was the provider in the case consulted with a hematologist, which indicated that she had megaloblastic anemia, and we were asked which of the following vitamin deficiencies is probably cause for the presentation of this condition, and we were given iron, B6, and B12. So in order for hemoglobin, which is our oxygen carrier in our body, to properly function, it needs iron to be present within it. Without an adequate amount of iron in the body, then there's not enough red blood cells to carry oxygen to different tissues that need it. Patients with iron deficiency might experience extreme fatigue, faster heartbeat, pale skin, weakness, and cold hands and feet, among other symptoms. Our vitamin B6 is very important for the maintenance of a healthy nervous system and immune system. In addition to, it's important when it comes to the brain development. A patient with deficiency in vitamin B6 can develop dermatitis, glossitis, depression, confusion, and weakness in their immune system, among other symptoms. And finally, vitamin B12 is a key role in making red blood cells and DNA synthesis, and is also a very important component in brain development and proper neural functioning. So side effects of um, having a deficiency in vitamin B12 in our bodies, like fatigue, shortness of breath, diarrhea, nervousness, like numbing, tingling sensations in like the person's toes or finger, and like lung extensions. So given all of this information that I researched, I would agree with the suggestion of the hematologist in this case, and I would also suggest that our patient suffers from megaloblastic anemia, and then I believe that our patients suffers from a vitamin B12 deficiency based on the symptoms that I already described. When the patient is deficient in iron, vitamin 6, and B12. The second question was discuss how this vitamin deficiency impair purine or pyrimidine metabolism. And here I would say that vitamin B12 or folate, which is very known for it, is required for both the metabolism of purine and pyridine. Sorry for my accent. Sometimes I don't know how to pronounce certain words. In pyrimidine synthesis, folate is needed for by the enzyme thymidylate synthase to transform DUMP into TMP, which is needed for the DNA synthesis. And in addition to this, deficiency in folate in vitamin B12 can also affect the metabolism of purines due to the dependency of methionine. And we have to remember the methionine is converted into SAM, which is then converted to SAH, which is it happens to SAM happens to be an inhibitor of 5-methyl tetrahydrofolate, which is used for our body to resynthesize methionine. And then we have to remember the methionine is a great source for the formation of purines, and that B12 plays an essential role in this process because within B12 we can resynthesize the methionine. So in the third question was list of potential laboratory tests and findings that would assist you with your differential between all of it. And then for this case, as they provided, I would like to run several tests like STBC, so I could see how are the levels of hemoglobin of our patient. I could also see if we have MVCs elevated, how the patient's platelets and white blood cells are, and I would think that in this case our patients would be low. And I would also like to do a PBS lab test, which shows how the microcytosis and hypersegmented neutrophils levels are. And lastly, I would like to do a bone marrow smear, and this is what allows to ask the providers to see if the patient's myeloid cells and megakaryocytes, like their level and how it's affecting the patient's disease. So I believe this lab test would confirm the diagnosis of megaloblastic anemia made by the hematologist consultant in this case. And I think that's everything that I got. Thank you so much for everything, Dr. Nabil, and thank you to every single like of my peers that have been so active in the discussions of Blackboard. I have loved this class and I have learned so much by studying it. This is my second time like taking the class, and I could like notice a lot of difference between the two. I have learned much more here. So I appreciate that. I appreciate your time and patience and help whenever I ask for it. So thank you so much. Merry Christmas, Happy New Year's, and I hope you have a wonderful rest of the year. Thank you. Bye bye.